So what do we think the key priorities are going to be for 2026?
That's what community health centers do. We do, as a routine basis, focus on chronic care management and wellness and empowering patients.
That's one thing that I think ACH will think about next year is like, how can our advocacy communications get even more sophisticated and fast and clear?
Hi, I'm Amanda Pears Kelly. I'm the CEO of Advocates for Community Health, and welcome to Community Health Centers Unfiltered. As 2025 comes to a close, and with it, the end of our very first podcast season, we're taking a moment to reflect on the year, the challenges we faced, and the lessons we've learned along the way. This year has tested community health centers in new ways, but it's also shown where we have opportunities to grow and advocate for stronger policies that support our patients and communities. In today's episode, we'll explore the key takeaways from 2025 and dive into what's next for 2026, because our mission to advance the health center program is ongoing, and the road ahead is just as important as the path behind us. So settle in and join us as we wrap up season 1 and look toward what's next for community health centers. Hi, guys.
Hi.
It's really good to be back here. I think most people know you. Everyone should know you. But for those who don't, can you just start by introducing yourself? Stephanie, you want to go first?
I will. Stephanie Krenrich. I'm SVP for Policy and Government Affairs at Advocates for Community Health.
Elizabeth Lee, Managing Director, Continuum Health Group.
Great. Thank you both. This is our powerhouse ACH team. We have some other team members that are not here with us for this conversation, but I want to start by just saying how grateful I am for both of you and how much incredible work has gone on this year. And as we look to the end of the year, which is wild, it flew by, and then there were days where it felt glacially slow.
Yeah, would you say it flew?
Yeah, just, some days were a little slow. But it was a persistent and a constant sort of, okay, now it's the next thing and the next thing and the next thing, many of which were really challenging. I do think there were some bright spots, and that brings me to my first question, the first part of the conversation. But what were the biggest policy challenges that ACH and health centers faced this year from your perspective?
I feel like in any new administration and the beginning of any new Congress, there's going to be a learning curve and a gap as you get to know the new folks in the administration, as you get to know new members and new staff. And I think that was just really supercharged this year. I think that's the first thing that comes to mind is this administration is really shaping the face of public health in this country. It's really reshaping how we approach healthcare in this country in terms of the policies that it's handing down. So I think that kind of some of the biggest impact that we saw was right out of the gate. I mean, we had a funds freeze for grants, we had administration directives coming down, and I think that, that's been the directives coming from the administration. I think that it's been a challenge for health centers to react to some of the new policies as they're coming down and really approach them and figure out the best way to approach them for us from a policy perspective. In terms of other challenges, I feel like HR 1, the One Big Beautiful Bill Act, that is really, that was a fast-moving train that I think a lot of us really tried to band together, not only in the health center community, but with folks throughout the health advocacy community to really influence how Congress and the administration were looking at the Medicaid program and some of the changes that they were pursuing. And ultimately, looking at that was a big challenge, trying to address that bill and kind of shape it in a way that it wouldn't have as much of an impact on community health centers. And I think what ended up coming out of that was a mixed bag. I think that kind of as we turn our sights to implementation of that bill, I think that's another challenge that we have coming in 2026. And other things that we looked at. I mean, some of the things that really stick out from 2025 are things where we identified opportunities and we plugged in, right? Things like the Make America Healthy Again work stream in HHS and at the White House, sort of how we looked at it and said, Make America Healthy Again. I mean, that's what community health centers do. We do, as a routine basis, focus on chronic care management and wellness and empowering patients. And how can we better position community health centers in that work stream? And I think we've done a really nice job there. But I think that, overall, I think it's been a complex year with a lot of shifting dynamics in health policy and in Washington. And I think Advocates for Community Health has really, if I do say so myself, I think we've done an okay job of sort of navigating all of that. But I want to hear what Elizabeth has to say too.
That was such a great answer. The only thing I would add is I think it was a challenge because of the pace of change and the pace of new policy to keep patients of health centers informed. Like, I just think patients are often our best advocates on the Hill and in their communities. And the changes were complicated. They were confusing. They were happening so quickly. There would be, I forgot about the funding freeze, but of course, like the funding freeze happened and then it was unfrozen and then it wasn't unfrozen. And I just think, in the opportunities that we've had to interact with community health center patients this year, it's just like, what is even happening in Washington? And some of it is still theoretical and they haven't felt they will, but they haven't felt the impacts yet. So I just think that's one thing that I think ACH will think about next year is like, how can our advocacy communications get even more sophisticated and fast and clear, because we need to pull patients and providers and leaders in the community in faster.
I would say that advocacy communications is challenging on a good day.
Such a good point.
But
yes.
But no, but I wanted to underscore what you were saying, because it's true. This year it was really just, times 100. So I think that's such a great point.
Yeah.
Yeah, that's something that came up actually in the fall at the NASHB conference. Where we were literally speaking with a bunch of state officials about what was going to happen with HR1 and engaging consumers and patients in sort of what the planning and the transformation is going to look like. But the challenge being a lot of the information hasn't made it to them yet. And frankly, it won't. It still isn't. And so, I think you're right, Elizabeth. I think one of the things that I really love about our team is we're constantly thinking about that voice and that opportunity to engage patients and consumers. But I agree. I think, that was a big challenge. I think reflecting also on, the first go around with the administration, there were changes and challenges then, as there is with any administration, to your point, Stephanie. But I think the last time change would come, we'd have some time to adjust and sort of calibrate. This time it was just steady and constant. So I think the other challenge is that there is so much change. Change can be difficult, but I think there's, burnout has been a buzzword since the pandemic. But I think burnout means something a little different in this moment, just reflecting on the past year, because there really was not a break. It was one thing to the next, to the next, to the next. But I will also call out the resilience, because I think that was an incredible showing from the health center community, and even still, and I think from ACH and a lot of the different advocacy groups doing the work. I think certainly we all have our days where it's a lot. But then
take a break, take a walk.
Yeah, take a walk. Yes, but then I think it's about the lens you choose, and I appreciate you bringing up MAHA, Stephanie, because I think that is an opportunity where, regardless of the politics associated with it, that's not really the point. But I think the opportunity to lean into the foundational components of MAHA and connect that to the role of health centers is really special, and I think really a great demonstration of where we can go in the future and how we can all lean in and where there's alignment. I think, again, if you take the politics out of the equation and you just look at, hey, we're talking about improved health outcomes. We're talking about making people healthy and keeping them healthy. I think everybody can agree on that. And I think health centers really serve as the solution in sort of driving that forward. So that's one of the bright spots, I think, from this year, but also where I think we can go in the future in 2026. But still kind of reflecting on the year and kind of building on the conversation, were there any unexpected lessons, or sort of like, okay, that's not a connection I expected to make, but just sort of lessons learned or hindsight 2020 even on some of what happened in the last year?
I think, where to start with this one? I think some of the real-time response in the health center community is a muscle that is not really well built out yet, because in the past, like what Stephanie was saying about the volume of challenges this year, in the past, health centers really advocate around their funding, and that's like pretty much it. I mean, 340B has been an issue, but that's what they talk about on the Hill most. And all of a sudden we were in these like incredibly complicated Medicaid policy discussions, and they, when I was probably like March or April saying HR1's never going to get passed by July 4th. And then it did. And we had literally weeks to read and digest this policy and understand how it would impact our health centers, develop our response, and advocate on that response. Like, health centers are not alone in this, but that is an insane turnaround to be ready to have like a sophisticated advocacy operation. And I think we need to be faster and I think ACH is pretty much as fast as it gets, but across the health center community faster at saying like, this is what's happening. This is our, maybe not perfect, but our read of what the impact's going to be. And this is how we advocate, and just get faster and be more willing to like make mistakes. Cause I just don't think we're used to doing that. I don't know if you agree with that. I just don't think we're used to doing that as much as others.
I mean, I could not agree more. I think that, it's what you mentioned a little bit on the last question about advocacy communications. And as policy professionals, it is always a challenge to digest and distill information into a form that is accessible, right, by everybody, so that it is easily accessible and that you have kind of directives to the field to say this is what needs to be done and this is how we need to do it. But to your point, this year, the time that we are given to do that is so compressed. And so, we got to get faster. And like you said, I do think ACH is really fast, but I think we got to get faster because usually it's not once a week we have new policies coming down the pike. And right now, that's exactly what it is. And the importance of grassroots advocacy and the importance of the field to react and reach out to their lawmakers. I mean, it could not be more important than it is right now. So as a community, I think that for the policy professionals in our community to get faster at getting that stuff out the door is really important.
But shout out to ACH members for the people that we emailed on the weekends and at night to say like, what would the impact of this be? And they get back right away. And I think, we have that. We're so blessed with the community of leaders at ACH and their ability to engage. I mean, it's really, it's huge, but I think we will only get better over time at doing that kind of real-time response.
Yeah, I was going to say, I think I do have a lot of appreciation, and I think that our ACH members, our network, was extremely responsive very quickly. They were constantly at the ready to sort of, whether it was come into Washington for a last minute meeting or to take, a virtual meeting or to pick up the phone to send an email, whatever it was. Like, and to your point, like there were a lot of, sorry, it's Sunday, sorry, it's the day before a holiday, sorry, whatever the timing was, but they were always ready to heed the call, which, that makes the difference. And I think this is an interesting year. I think 2025 is one where, and sometimes as it relates to advocacy and strategy, is sometimes it's avoiding a potentially even worse outcome.
Oh yeah.
I think that sometimes gets lost because we all want to have the, specific victory with whatever the, outcome, the goal outcome is. And we had some of those, but I think in this particular case, there were things that we were able to steer clear of or keep off the table, which I think is equally as large a victory, if not larger in certain cases. Definitely. But I agree with you, though, Elizabeth, in terms of what you're saying about agility and quickness, and I think also just willingness to change.
Yeah, totally. Yes.
I think that even the advocacy strategy is completely different than I've ever seen. I mean, without getting into the politics or the details, I think there were certain tried and true advocacy tactics that have worked for the 20 years that I've been doing this. Yeah. And in 2025, they didn't work. Mm-hmm. It was not what resonated, whether that was data, whether that was, some number of constituents, that was not what was going to make the difference. And so I think leaning into that change and understanding whether that's an adjustment of communication or, quite frankly, just a willingness to change. Okay, I can't change. I'm not prepared to change my mission or the vision of what we're going after. But what I can do is look at, is there a way to change the way we accomplish that in order to find common ground? And I think that was something that I watched us do at ACH, but I also watched our members do it, and I think that that's another one where change can be difficult, it can be painful, but it can also be really incredible. It's difficult when there's uncertainty associated with it. I'm not going to diminish that. And I think there was a fair amount of that not a fair amount. There was a lot of that in 2025, and there probably will be in 2026. But I think that agility and that willingness to change was both a lesson learned, but also I think just a really great example of strength and resilience. So the other thing, just looking back, is what, from your perspective, both of you, I think, Stephanie, maybe you'll take it first, but what did federal developments look like in terms of the specific impact on health centers, and what did we learn from that?
Well, I think that this year has been a big focus on the financial sustainability of health centers. The common theme I feel in the biggest issues that we've encountered this year, and the biggest ones that we've really spent a lot of our time on, are ones where we're trying to maintain the stability of the health center program and the healthcare safety net. And all the different ways that health centers stay solvent. So you look at something like the health center fund, the community health center fund, the entire year this year it has been funded through extensions. And, we are advocating for an increase and a sustained authorization. And that is something we are still fighting for, right? And we look at something like 340B, which is arguably the thing I am spending most of my time on at the moment. And there have been a lot of changes in the 340B program. I mean, we started this year sounding the alarm on the possibility of a rebate model, and now we are looking at the rebate model pilot program being implemented on January 1st. Hopefully it won't be, and hopefully we can achieve what we're trying to do with a delay, but or carving out community health centers. But that is another thing, and I think that is it's so important to community health centers to have a strong 340B program and for health centers to be able to continue to benefit from it. And we are seeing over time that ability is being eroded. So that is another big issue that we've encountered this year. And obviously also HR 1, the One Big Beautiful Bill Act, with the changes coming down the pike on Medicaid. People are going to lose their health insurance. There's work requirements coming down the pike. How are health centers going to be part of the solution there? How are health centers going to help their patients maintain their coverage? What does that look like, kind of as we look at all of this? And for me, the lessons learned, I think about just the critical importance of relationship building. And I mean that in a few different ways. One thing we did this year was we really stepped up our efforts with some of the more conservative think tanks and associations, and really tried to lay a foundation with those organizations, create and maintain and strengthen those relationships, and really make a conservative case for community health centers. And I think that is critically important and a huge component of what we're trying to do. But I think it's also, with this new administration in particular, but kind of establishing relationships with administration figures who have policy-making, decision-making ability when it comes to health center issues. We were in with the Office of Management and Budget a few times this year, and I think those were really productive meetings. We were in with the Office of Medicaid and CHIP Services. We talked to the CMS Innovation Center a bunch, and it's really making sure that we are telling the story. It is going in and saying, these are the things that you want to accomplish, and this is how health centers can help you accomplish your goals. And that is the name of the game in Washington, and I feel like for all of the ways that advocacy was different this year, and for all of the ways that I personally, after doing this for 20 years, was like, wow, that is different from how it's worked in the past. It was really different. Things like relationship building and its value, I think stayed relevant, and I think that is something that I got out of this year. But I really want to hear what else Elizabeth has to say about this too, because I think it's an interesting question.
And the last thing that you said, just about like everything feeling different, I think sometimes health centers have benefited from the tailwinds, I think.
Yeah,
which is from the back, tailwinds of the rest of the health care community, right? Like usually what's good for hospitals is pretty good for, like, we're part of a broader healthcare provider community, and those people don't have the power that they used to have. And I think, physicians, hospitals, all of it. And so I think we learned that we as health centers, like, we have this identity that has existed for however long we've all been doing this, 60 years. Yeah. And I think we need to evolve that to be separate and to be equal partners to some of these other players in the healthcare system, because we can't just sort of defer to them and assume that they'll win on our behalf, because they're not always winning. So I just think it's really interesting, like the MAHA connection and some of the other, like all of the incredible tech work that health centers are doing. Like, I think there's ways to evolve our identity on the Hill and really be seen as a sophisticated healthcare leader that's part of policy discussions, rather than just being sort of like impacted by them, if that makes sense.
And I will say too, just really, really quickly, just in times of great change, there are really great opportunities.
Yeah.
And that is absolutely one of them
Yeah.
for health centers to really, for the community to step on its own and be seen as kind of equal in heft to
Yeah.
the other healthcare
Exactly. Yeah.
advocacies. Sorry.
Yeah.
No, don't apologize. I mean, I think the other thing that I would add on, just an observation, and maybe this is where you guys kick me under the table for saying this out loud, but but I think the other thing is there appears to be sort of, whether intentional or not, different segments of healthcare that are working against each other.
Yeah.
And in ways that I don't think has been particularly common in the past. And so I think in the past, health centers may or may not have been in the middle of it, but I think they have been a little bit more in the last year. But I think it gets at what both of you are saying, which is like, it's an opportunity for us to step back and say, we're not going to get sucked into the hornet's nest that is this. We need to stand separately and for exactly who we are, and not just the legacy, but all of what can be, with appropriate support and resources. But I think that was a different differentiator in 2025, is that I think health centers, in some ways, it was like, there were times where it was like watching a tennis match where it's like, okay, but we want to stop looking at the lobbing back and forth and go go find our own game, you know, or at least not even a game, just let's, you know. But that excites me for health centers in a way, because I think it's a continued maturity.
Yes.
You know,
absolutely.
I think that we have this incredible 60-year legacy, which, wild to, you know, that the 2025 happens to be the 60th anniversary year. But to have that incredible legacy, but really to be thinking about, okay, like, but what does it look like going forward? And what does the future look like? Not just for the year ahead, but for the next 60 years.
Yeah.
And I think the exciting thing about our members, we had our best practices showcase in October, and holy smokes, that meeting was just exceptional. Like, I came away from that meeting feeling like, not only is this going to be okay, but this is what health centers are really about. It was about, and the entire meeting was dedicated to the innovations, to the bigger vision, to the continued evolution of the model, you know, keeping all of the things that we hold so dear at the core, but being able to say, it's bigger than that, and we can grow beyond that. And in fact, as we do that, this is how we fit into the bigger ecosystem of the healthcare system as a whole. And whether it's MAHA or just transformation in general, health centers are the pivotal component of that. Yep. And I think our members represent that really beautifully. So I have to say that October meeting for me was such a needed bright spot. And I think everybody else at the meeting honestly came away feeling the same way. But that's probably a good segue into the second part of the conversation I wanted to have with you guys, just kind of thinking ahead to next year. And it's wild that it's just weeks away at this point. But so what do we think the key priorities are going to be for 2026?
So I think for us, we're really focusing on 340B. So as always,
Shocker.
perennially, something new. We're going to be focusing on 340B. So we're looking at obviously continued, I mean, depending on what happens with the rebate model, there's legal action now on the rebate model. Yeah. So that remains unclear. But we're going to keep engaging and both helping our members implement the rebate model if need be, helping our members get ready for what's coming from the administration on 340B. And also in Congress, the Gang of Six, the bipartisan group of 3 Democrats and 3 Republican senators, are still working on legislation. And we saw at the hearing in the Health Committee a few weeks ago where Chairman Cassidy, you know, had said that he looks forward to seeing what comes out of that group. So that gives us a little bit more direction and a little bit of more of an ability to kind of know who to follow and kind of know who to be talking to. And we've obviously been engaged with all of those players this entire time, but making sure that health centers are at the table as those conversations are happening on 340B reform legislation. I think that that is going to be really, really important. So also funding, we have a new, the next fiscal funding cliff is January 30th. So as we near the end of this CR, thinking through how we're going to approach that. And how best to advocate and what is going to be most influential on the decision makers for funding. We want to see a sustained, longer-term authorization with increased funding for community health centers, and we are going to do our best to make that happen. So funding, as always, is going to be really, really important.
Can I add something to that?
Always.
Because I'm going to anyway. So on the funding piece, I think the other priority that we will focus on it's sort of a parallel track of, what might it look like to have a larger pool of investment to support something like MAHA or something wider, but basically carving out a portion of that specifically for health centers, which I think, I think they are parallel because they probably run simultaneous depending on what they do in January. But I think, that's a non-traditional approach to the funding piece of things as a priority, but I'm excited about that in 2026, honestly.
Yeah.
So am I. And I think also as we're looking at those issues, we're looking at implementation of the Medicaid changes and helping our members weather what's coming when that as that comes down the pike. We are also looking at workforce. We have a lot of really great proactive things we're doing in the workforce space. The Alliance for America's Healthcare Workforce for the Underserved is our new alliance. I think I got the name right. It's long. I'm going to get it one of these days, but it is so exciting, and I hate that I keep tripping over the name. But it's a really exciting thing we're doing with Association of Clinicians for the Underserved and the National Medical Association, which is the provider association for Black doctors, and also the National Association of Rural Health Clinics. And I think this alliance is such a great opportunity for those organizations that form the executive committee and the other organizations in the coalition to really push smart, bipartisan policy initiatives that are going to help bolster the healthcare workforce in the communities that need it. And it is, I think with a lot of stuff that's happening right now, we're kind of trying to stave off bad things, and it's playing whack-a-mole with things coming down the pike. But this is a really cool proactive thing we're doing, and joining together with some really big smart advocacy voices in the space. So I think that's going to be really exciting in the workforce space. And also value-based care. We're going to be continuing our focus on value-based care for health centers and ensuring that they can integrate into alternative payment models and really think through better ways to serve their patients. And that means continuing our conversations with the CMS Innovation Center, and really just kind of making sure that we have our fingers on the pulse of what our members need, and what health centers need in that space, and make sure that we are giving them all of the tools and resources they need in that space. I've been talking for a long time. What other policy issues are we going to do?
That was great. That was great. I mean, I think this segues, into the next thing we're going to talk about, but I would love to help support our health centers engage with their states directly. A lot of how HR 1 plays out is going to be based on state decisions, how they define exemptions for work requirements, how they implement their rural health transformation funds. So I think, it's not a place that ACH has tremendous capacity just because we have a very small team. But I think what we're trying to do is toolkits and playbooks and things to kind of give people templates to interact with their states, because health centers are such a valued state partner already, and I think just helping to make our case that we could help you implement this, minimize the impact on health center patients. I'd really love to support our health centers in that, because I think that that's a great way, as you said, we're staving off bad things, but it's also an opportunity. There is real money in some of those rural funds, and the way the states are going to redo some of their Medicaid programs. So I think there's opportunity for health centers there to be at the table, and I would love to support them in that.
Yeah, I think so. Couple things. I think on to that end, Elizabeth, I think, I'm super grateful for the relationships and the work that we do in partnership with the PCAs.
Yeah.
And so I think continuing that through, especially for what you're talking about, so many of them have already done just an exceptional job of navigating what was a fairly complex and sometimes a little unclear process in terms of the fund itself. But I think as it continues to be implemented, working with them and with health centers and just basically all hands on deck to try to, work through it the best that we can. But I think two pieces related to this, and also I think, just all of the changes for the rebate model, even in the year ahead, depending on where we land with that. But I think also being able to extract the lessons learned, and pull out the best practices, because they will emerge. I think one of the most incredible, amazing, beautiful things about health centers is that they are masters of figuring it out. And then at the same time, it's like, the policymakers know that they always figure it out. So they, you'll figure it out.
Right.
But I do, anything that we can do to extract those things particularly in those areas, is going to be a really important part of, I think, what we do in 2026, and carrying that back to policymakers to make adjustments to policy and sort of the continued approach, and sort of what does this look like, and what's working well, where can we build, and also what is failing miserably, because there will be both. But then the other thing, I think, in terms of 2026 and priorities, and it's sort of, ACH has this sort of emerging issues bucket. But I think one of the reasons that ACH launched, literally at inception, was to harness the incredible innovations that are going on across our members. And so whether that's in technology, it's in continued clinical efforts, integration, like there's so many different areas, but I'm excited about that too, because I think, there is a ton of change going on, which lends itself to opportunity, where some of those innovations might fit really nicely into some of the initiatives that are being taken up right now by the administration and Congress. And so I think continued effort in that space, and really leaning into, again, going back to the change, there's our theme, maybe, by necessity or by choice, but leaning into that to say, okay, what can that look like? What does that continued transformation look like when you pull in and harness technology, when you start to look at, different care integrations and different service models, et cetera. So that's another one for 2026 that we do have a limited team, but somehow you guys do an exceptional job of managing all of it. But, the other thing I'm really proud of is that these priorities are driven 100% by our members.
Yeah.
You know what I mean?
Yeah.
And this is, this week, last week, it's pretty constant because it's on regular, but just continuing to have those conversations with our members to help guide the direction of ACH and sort of how we're responding to things, but also strategically, like, where are we going and where are there opportunities? Because I think that's the other thing I love hearing from our members, where they sort of identify, okay, based on what I'm experiencing on the ground, here's a space where I think we can do more.
Yeah.
Or if we adjusted a policy, it clears the way to do something else. And so, I think I feel that's a very exceptional and invaluable thing about ACH, and something really special that we've been able to keep intact and will always keep intact as long as I'm doing the work. All right. So the next question, because there's still lots to talk about, is what are the new areas of policy or legislation where ACH sees an opportunity to make an impact?
Well, I think that there's a few things. I mean, we're looking at emerging technology issues like AI. I think that we just started a learning collaborative for our members on technology, and we're really looking at ways that policy can help support what health centers can do with emerging technologies. So I think that is definitely something we're looking at, kind of emerging in the next couple of years. But also, I have to say, kind of everything old is new again. The stuff that comes up in healthcare in cycles. So when I think about something like 340B, 340B is really on the brain, you guys. I'm sorry. But like when I think about something like 340B, I think about, the reform legislation that we're looking at. This year has been a big kind of rebuilding year for the Gang of Six in the Senate. They've got a bunch of new members kind of thinking through how they want to approach the current landscape in 340B. So I think that is something that's going to come up next year. So much in healthcare is cyclical. I think we're obviously going to continue talking about coverage issues. I think that is something that, has been a perennial issue and will become an issue once again. Right now, we're looking at ACA enhanced subsidies and the possibility of extending them beyond December 31st. So how are we going to be approaching coverage issues next year, particularly in the wake of HR 1 and all the different changes to coverage policy in this country? So there is that as well that I think we're looking at next year. But Elizabeth, what do you think?
Just to underscore the tech thing, there was just yesterday an announcement of a new CMMI model called the Access model, where participants can use emerging technologies to take care of folks with chronic disease and prevent chronic disease. And I think that's really exciting because our members are already doing that. And if you participate in that model, you don't have to charge a copay, which is really great. And that can be a huge barrier. So we have so much to teach across the healthcare industry about how to manage people with chronic diseases. I don't think people realize. So I would love to get us kind of at the forefront of that conversation about like the old school, like managing a patient between, a clinician and a patient, and then what we can do with tech and AI and text, like all the technology that's changing every single day. So I think as, RFK and other leaders talk about chronic diseases, no one knows it better than Health Center and Health Centers clinicians. So I'm excited for us to be at the front of that. I also think, just to go back to workforce, like there's so much changing on the workforce front, and I think we can lead those conversations as well. We leverage so many different parts of the care team, from frontline workers to, the most trained physician ever. And I think that we can really rebuild those models in different and creative ways to deal with some of the coverage challenges that Stephanie was talking about. So as we have always been this innovation lab, we will continue to do that. And I just, it's our job to make sure that policymakers know about that every step of the way.
Yeah, I'm glad you brought up workforce, because I think there's a few perfect storms right now. But this is another one where I think health centers are in such a fabulous position. They're already doing it in terms of like training and education, but there's so much more that can be done if we can clear the way and, find a way to leverage more resources. But it's absolutely necessary. I also think that health centers are really, really skilled at evolving a care model, honestly, to make the most of the team that they have to create the best outcomes for their patients. And so, and the data's there, you know what I mean? Like that's the other advantage that health centers have in terms of being able to track a lot of this stuff. And then above and beyond, not just UDS. I think so many of them, especially our ACH members, are collecting additional data to be able to demonstrate the impact that they're having. I'm also glad you brought up CMMI, because I think that's a bright spot, I would say, in 2025, is just in the conversations that we've had, the willingness to think specifically about what health centers need as they continue to develop models, but then also to have conversations about Medicaid. Yeah. And so I'm excited about that in 2026, to continue those conversations and really to be able to lean into a space that hasn't in the past had a lot of opportunity. So particularly if sometimes it seems clear that the marriage with tech, especially in that space, is going to be really relevant. And what better place to be able to pilot some of those things than health centers? Yeah. So that's another one. But there's, these are bright spots. I appreciate it.
And can I add one thing onto the CMMI conversation? I think dual eligible beneficiaries is something that comes up a lot. Yep. And it's come up with CMMI as well. Just how do we make that population as healthy and thriving as possible? And some of our members have done such amazing things with the PACE model. I know it's not available in every state, but I think what health centers are able to do in combination with the PACE model for older Americans, dual eligible Americans, is amazing. And I would love to, I know Stephanie and I are both having conversations about how to kind of partner with PACE on a national level and make sure that health centers are also at the front of that conversation, because my understanding is that in a lot of cases, like when folks get eligible for Medicare, they'll be sort of sucked into another care provider out of a health center, which is like the last thing we want to have happen. And I would love to have health centers really be like the provider of choice for Medicare and dual eligible beneficiaries. And I know there's, Chairman Cassidy, there's a bunch of folks on the Hill who are really interested in the issue of duals. So I'd love to see us work on that too.
Yeah, well, and the numbers are going to continue to climb.
Totally.
So, I mean, I think that's another one where there's an opportunity, but it's also a little bit by necessity. Yeah. Okay, well, I have one last question for you. Okay. I mean, we've had a nice highlight reel. We've talked about what we're going to do in the future, but I'm always going to bring it back to advocacy. And so if there's one thing you'd like policymakers to understand about the needs of health centers in 2026, what would it be?
That health centers cannot continue to do more with less. I feel like.
Can you say that again? Can you say that again?
Health centers cannot continue to do more with less. Our fabulous communications team put out a really nice graphic earlier this year on the diminishing value of health center funding per patient. And I think it is extremely important to note that as we have relatively flat, we've had a couple of increases, or one small increase in March 2024 for the health center fund, but we've mostly been flat, besides the extra COVID money, which was very badly needed for a specific purpose. We've had mostly flat federal funding for years. What year is it? It's almost 2026. It's been like 8 years or something that we've had flat funding. And with the Medicaid changes coming down the pike, there is a strong possibility of millions of people losing their health insurance coverage. And health centers are where they go, where uninsured people go for health care. And they should. That's why they're there. But also all of those challenges, along with the eroding value of the 340B program for community health centers and the dire need to stabilize that, health centers are going to have to start cutting services. They may start closing their doors at the time when we may see an increase in uninsured people. It is just the situation right now. I think that, yes, that is the one thing that I would tell our policymakers, is that we can't continue to do more with less. But the positive side of that is they have an opportunity to really lean into a lot of the stated goals of the administration and a lot of the stated goals of the Make America Healthy Again movement, which is leaning into prevention and chronic care management and into really kind of empowering their patients. And this is a great way to do it, is to really prop up and fully fund and help the health center program be everything that it can be. But yeah, that's what I wanted to know.
I would just say keep them at the table, like every single, for federal and state and local policymakers. I think health centers have such an important perspective to share, and as soon as they can share it, the better the ultimate policy will be, especially in shaping just the implementation of HR 1. And as, the House might flip next year, we might be having conversations about different kinds of bipartisan initiatives. Like, health centers have to be part of that conversation about how we're approaching healthcare delivery, or we're just gonna miss out on such an important perspective. So I think they can't do more with less, and they also can't not be double negative part of the conversation. They have to be at every table that other healthcare providers are. And I think also that they are just just to come back to the innovation, I wish every single policymaker in Congress, hopefully they have been to their local community health center. And if not, they need to in the next year, just to see what an incredible resource they have in their community. And I think health centers are pretty good about making that happen, but also getting the staff there, making sure, committee staff have been to health centers, just making sure, because when you actually see it in practice, I just think it makes it so real. So I'd like them to understand too, they care for your constituents, and they are there for you as an advisor in the same equal measure.
So I would second both of you, but I think I would add to it that if I were having a conversation with a policymaker, specifically here in DC, health centers are not about politics. They're about people.
Yep.
And it's about taking care of the people that are in the greatest need,
yep,
but also doing so in the most cost-effective way. Mm-hmm. And whatever side of the aisle that you happen to sit on, health centers are the solution. Mm-hmm. It's sort of all signs and paths lead to health centers. Mm-hmm. And it doesn't mean that there isn't still opportunity to change and continue to evolve and do more. And transform. But the answer is really simple. It reminds me I had a little stint away from health centers, and my poor colleagues, because every week I'd be like, health centers can do that. Health centers are an answer for that. Literally whatever the challenge was, but I meant it. And I think that's what I would love for policymakers to understand, that if the first thought could be health centers for whatever it is they're trying to consider in the healthcare space. If they could start with health centers and just consider what it can look like foundationally, and then build off of that, I think that's not just a solution. I think that's the answer to so many of the things that are being considered right now and viewed as challenges. I think depending on where you happen to sit ideologically, and I'm not commenting on what's right or wrong, but I think both arrive at similar answers. They just are not necessarily thinking health centers. And so I think it's bringing that forward. Yeah. But I also really agree, and I want to call out what you said, Stephanie, that it's, we had the piece earlier this year where we sort of likened the situation to a game of Jenga, a really awful game of Jenga. And I think that that's sadly the reality. It's as things are changing, whatever the intentions are, if we keep pulling blocks out from the foundation, eventually it's going to topple over. Yeah. And that's scary and sad as it relates to health centers, but I think even more devastating as it relates to people and communities.
Yeah.
So, but I prefer to think about what can be, and this year I've used the Phoenix story a lot of like, okay, well, when there's massive change and it feels like everything's burning at times, there's something really incredible that can come out of the ashes. And I think that's the health center story.
Yeah.
And I think it has to be for 2026 and beyond.
Yeah.
So any final words from either of you?
Thanks for having us.
Yeah, thank you so much for having us. It's great.
Yeah, well, thanks for everybody who was able to join us in person. If you are enjoying the conversation of Community Health Centers Unfiltered, we hope that you will subscribe and share with your friends. But more than anything, I also want to thank you for joining us and for helping us to make the podcast successful, and for supporting these guys who do exceptional work every day on the policy and advocacy front. But it's truly a privilege and an honor to be able to support this work and to be able to host this great podcast. So thanks everybody for joining us, and have a wonderful holiday, and we will see you next time.